Right, it's 2 minutes past. Welcome everyone. I'm Michael Green from the Social Progress Imperative. Lovely to see you here and joining us at this difficult time for the world when we have a chance to see about how we can wrestle with this challenge and deliver the outcomes, the better outcomes from this for our world. I'm delighted to be joined with me today in this discussion by Dr. Amit Kapoor from India. Amit, you might want to give us a wave. And also by Matthew Bishop, who is a strategic advisor to Catalyst 2030. And I think I should start by saying big thanks to the Catalyst 2030 team for making this happen and driving this process and hosting these critical discussions. It's great to have this movement, this coalition coming together at these difficult times. So what we were going to do was just begin by talking through some of the findings. This is a very specific crisis in that COVID-19 is so new and we know very little about it. And there's lots of data emerging and there's lots of discussion about the data, but we know that the data is incredibly incomplete. The data we have on infection rates, even the data on mortality rates is incomplete. And also we're very early in the crisis. Some countries have been hit earlier than others. So trying to make comparisons between countries within countries is incredibly complicated at this time. So something we've been wrestling with at the Social Progress Imperative is, how do we actually use data to inform this crisis, inform the response to this crisis, recognizing that the data about COVID-19 itself is so unreliable. So what we want to share with you today is a couple of pieces of work that we've done that are, they've been done quickly. We really welcome feedback and we welcome this discussion as a chance to share them and get a group of smart people thinking about the data. First, one of which is a global piece of work where we've looked at different countries' resilience to infectious diseases using data from the Social Progress Index. And the second piece of work is looking at the underlying vulnerability of communities. We've done this for cities in the US, and we've also, Amit's done some work applying the same methodology to states within India. So we will share this data, tell you what we're finding, talk a little bit about how this data is being used. We've actually got some colleagues on the line who are using this data and have been instrumental in building it, and I'm sure can join in and share some ideas. If you want to come into the conversation, drop me a message directly or drop a message to everyone in the chat, and we can keep the conversation flowing. So it's not just all talk and presentation. So that's the plan for the session. And I wanted to just kick off by sharing you the research that we've done initially on looking at the resilience of different countries to COVID-19. And I want to give a shout out to our colleague Petra Krylova, who's online, who with the research team at SBI did a huge amount of work in creating this measure. So let me just share my screen now and pop open a presentation showing some of the results. Okay. Let's get this ready. It is always fun watching the school teachers wrestling with these devices with the technology when my 8-year-old uses it so much better. So I wish I had my 8-year-old with me right now to help me out on this. So let me just get this presentation ready and share this with you.
Rather than later to all 5 of them.
Oh, and make sure that we are muting everyone so we don't get the background noise. Okay. So sharing my screen now. Here we go. Excellent. So we've created a measure that we call social resilience to infectious diseases. And what this is what we've done is we've taken Social Progress Index data and said, what specific aspects of social progress do we think are going to be important in particular in reducing the spread of COVID-19? And conceptually, there seem to be 3 particular aspects of social progress that were directly relevant to reducing the spread of COVID-19. First of all, water and sanitation. Can people keep themselves clean, wash their hands? That's a huge part of preventing COVID-19. So water and sanitation, we thought should matter. Secondly, shelter. If we're talking about lockdown, people staying safe, is there good shelter? Is there good infrastructure? Is going to be really important. Luke, could I ask you as co-host to make sure that people are muted so they don't get the background noise, please? And then thirdly, health and wellness. Do we have health systems to make sure that people are kept healthy, not just to respond to the disease, but also to ensure there's good health in the population? So these three factors conceptually seem to us definitely, seem to be important in preventing infectious diseases in general and COVID-19 in particular. We then did some testing and we looked at this measure of social resilience and tested it against deaths from infectious diseases. And we found a very strong relationship. So deaths from infectious diseases, not including COVID-19, of course, because we don't have data for that. And these three factors, there seem to be a strong relationship. So social resilience to infectious diseases seem to be a meaningful measure to compare countries by. And what we found was that the best performing countries, were ones that seemed quite familiar, generally richer countries, Switzerland at the top, followed by Singapore, Japan, and others. Now, obviously, a lot of these countries are some of the hardest hit at the moment. But of course, that's about the speed of spread of the disease. Some of these have been early, countries have been hit early. So we can't really compare resilience based on current infection rates or mortality rates. But what we are saying here is that these are the countries that seem to have more resilience than others to deal with a crisis. Whereas if we look at the other end of the scale, the countries at the bottom of this ranking are very much poorer countries where there's less access to water and sanitation, there's less access to shelter, there's less access to health services. Now, a really important caveat in this, of course, is that there are other factors that are going to be influencing the impact of COVID-19. We know that age is a critical factor, and on the whole, poorer countries have younger populations than richer countries. So this isn't the whole story, and the way in which the speed with which infection spreads is going to be an important part of the story as well. So social resilience is just part of the story on the impact of COVID-19, but we are seeing there's some big variation in the resilience of countries. A lot of it related to richer countries versus poorer countries. But what we've done to break that down a bit further is we've had a look at the relationship of this social resilience and GDP per capita. And this broadly bears out that proposition that richer countries tend to have a higher level of social resilience. So social resilience to infectious diseases on the vertical axis, and then GDP per capita on the horizontal axis. So there's a pretty strong relationship between GDP per capita, the wealth of a country, and the level of social resilience, as we might expect. But when you break it down, you are seeing there are some very interesting outliers and some noise around this trend line. What I'm going to do now is look at 4 groups of countries by income group, where we see different characteristics. So first of all, we look at high income countries. And so here you see that there's a very wide range of GDPs per capita for these countries, some exceedingly rich countries and some that are, got a GDP per capita of around $18,000 a year. So huge range of different incomes, but actually the range of scores on social resilience is pretty narrow. And these countries are quite tightly packed together on these resilience scores. But there are some interesting outliers. I think particularly countries that have very high GDPs driven by natural resources, Qatar, United Arab Emirates, Saudi Arabia, etc. They have in general a lower level of social progress relative to their GDP. And we do see they have a lower level of social resilience to infectious diseases, which suggests that they could be more vulnerable than other richer countries. And we also see notably here, as with social progress, that the United States seems to be a bit of an outlier in terms of its social resilience relative to its economic strength. If we move on then next to the upper middle income countries, we see a much wider spread of results here. On the positive side, you see that a country like Costa Rica, which is again an overperformer on social progress, shows a very high score on social resilience, on a par very much with high income countries. And indeed, we don't want to jump to too many conclusions, but it is interesting to see how well Costa Rica is doing in handling COVID-19 at the moment. And then we also see Jordan does very well. Obviously, lots of issues with refugee camps, but a country of pretty modest GDP per capita is showing quite a high level of resilience. On the negative side, again, we see it's countries that have GDPs that are inflated by natural resources like Namibia, Equatorial Guinea, and Libya, which of course has issues of conflict, are underperformers. But we were quite struck that we see here in this category that Romania, a member of the European Union, looks quite vulnerable on its social resilience to COVID-19, to infectious diseases. It seemed quite surprising to us that Romania was seemed to be that vulnerable. The biggest spread we find actually is in lower middle income countries, a huge range of possibilities here. We see actually the lowest scoring country in absolute terms is Papua New Guinea, which has significant deficits, especially around basic infrastructure like water and sanitation and services, because of the complexity of the geography there, means that those services are at a very low level. And then we also see, again, resource-rich countries seem to be more vulnerable. Nigeria, Mongolia, but also Indonesia, and maybe to a degree India, are showing a degree of vulnerability. And then countries that are doing well include Kyrgyzstan, and then again Tunisia seems to be performing quite well relative to its GDP, a level of resilience very close to some high-income countries. And then we get to low-income countries. It's a very narrow range of GDP, but a very wide range of resilience scores. Tajikistan there at the top scores a lot better than other countries of similar GDP per capita. Sudan's at the bottom. And then we see some countries like Nepal, the Gambia, and Rwanda that seem to be that have, again, risks, issues of resilience, but they do have in terms of absolute terms, but relative to their wealth, they're doing relatively well as a group of countries. So this, I mean, the relevance of this data, I think, is helping us to understand, particularly in terms of international assistance, which countries are going to need the most help. Because it's not necessarily just the richest countries or the poorest countries are going to need the most help. There are countries that could have not the lowest GDPs per capita. They aren't the poorest countries, but may actually be much more vulnerable than their GDP would suggest. And that's going to be important for us in thinking about the international response to this and the countries that are going to need the most support in responding to this crisis. So that's one piece of the jigsaw, where we can say, look, here's the resilience of countries to COVID-19 if the infection hits, subject to the caveat of countries' underlying vulnerability. But we knew that was one piece of the jigsaw. So what I'm going to do quickly now is show you another piece of the jigsaw, which is the work we've done looking at that underlying vulnerability. And we've done this, we have a data set for this to look at the COVID-19 for US cities. There's a data set from the US Center for Disease Control that we could use to do this. And my colleagues, Justin Edwards and Dustin Davis, created this piece of work. So rather than building off Social Progress Index, what we did was build a vulnerability index based on what we know about what causes mortality from COVID-19. We know that you need a strong health infrastructure. So we looked in the first pillar at what's the quality of the health infrastructure in a community. Secondly, we know that underlying health issues are an issue. So we looked again based on CDC data on mortality, we looked at the underlying health of communities. And then thirdly, we knew that population demographics mattered. And so again, we broke those out into a pillar. Now, what we did was we weighted this model based on what we know about contributions to mortality from COVID-19. Those numbers may change and evolve over time, and they may be different in different countries. But for the US, this is using the current data, what we know about COVID-19 and mortality risk. And what we found was that there's a very widespread in results, in performance. And we found that the worst performing city of the 500 was actually Gary, Indiana, which suffers from a real combination of problems around the health infrastructure. The demographics are not so favorable, but really it's the underlying health issues in Gary, Indiana have really driven them to be the most vulnerable city in the US if and when COVID-19 hits. And across this top 20 and indeed across the top 50, we were very struck that the most vulnerable cities were actually in places like Florida, driven by some of the health demographics, but also in the Rust Belt states, driven by factors around the lack of health infrastructure, but also driven by the generally, on average, poor health quality of the population. By contrast, if we look the other way around, on the least vulnerable cities, we tended to find a lot of them were college towns, which often had very good health facilities, but also tended to have favorable demographics and favorable health data. And all this ranking is very public. And it will be notable to see that, you know, one of the cities that has had the most largest outbreak can you make sure everyone's muted, please? I'm getting feedback. Is that actually New York has been sort of the epicenter of the infection rate and mortality rate, but actually we found it in the middle of the pack. So there are more than 200 cities more vulnerable than New York City in this crisis. So it's, again, emphasizing that those that have been hit first aren't necessarily those that are the most vulnerable if and when the virus hits. We then went a bit further, and this is a bit of analysis because a lot of discussion has been had about who's most vulnerable and what's driving it. And for the 500 cities, we did find, you know, a significant relationship between the size of the African American population and COVID-19 vulnerability. I think, you know, highlighting this point that the underlying inequalities that are drivers of the mortality rate from this crisis, from this disease, and that COVID-19 is exposing how the inequalities of our society and the human cost of those. We went a bit further as well as looking at the cities, though, and started looking at the census tracts, those community level measurement. So here on this slide, we're showing the vulnerability index for Gary, Indiana. And as you see broken down, for Gary, it's pretty bad all over. The darker colors means more vulnerability. And the whole city really has got a lot of risk, a lot of vulnerability to COVID-19. Whereas, you know, if we look at College Station, which was the joint best performing, least vulnerable, again, it's a pretty, you know, most of it is a relatively low score. There are some differences between communities, and some are at more risk than others. But it's a fairly consistent picture across the city. On the other hand, we saw some cities got a very high degree of variance, neighborhood by neighborhood, community by community. Chicago, for example, faces a number of risks. It's somewhere in the middle of the pack. It's 266th in terms of absolute risk. It's in the middle of the pack, but it's the 24th highest in its level of disparity. So even if Chicago is not one of the most vulnerable, it's in absolute, on average, it's got a large number of some of the most vulnerable communities. And similarly, we look at Atlanta, that's also in the middle of the pack, but an enormous disparity, one of the largest disparities of all the US cities in terms of vulnerability. And what we can do, we're mapping these communities, is we can also drill down and look at the characteristics of each of these census tracts to help us understand the drivers of this, the underlying factors that are contributing to it. And as we drill down further, what we've also done for all of those census tracts is looked again at vulnerability against demographics, and again, very clearly with all these observations, confirming the observation around how inequality, discrimination is a driver behind vulnerability to COVID-19. So that's some information on the work we've done around resilience and vulnerability, which will make sure all the links are there to be shared so that people can see them and look into the data a bit further. And what I'd like to do now is just quickly pass on to my friend and colleague Amit Kapoor to share how this is now, the analysis has been done for India in a very different context. So Amit, may I pass over to you to share the findings of the India Vulnerability Index, please? And let's make sure that Amit is unmuted.
Okay, am I audible now?
Yes, we can hear you. Oh, no, we can't hear you now. You're good.
Michael, thanks a lot for the opportunity. Just following up from what Michael had actually said, what we did in India was something very similar to what was done for United States cities. But we really wanted to understand as to how things are really happening within the states itself in the country. And so we actually looked at 35 distinct locations for the country. But having said that, I think India actually had a huge challenge that was posed because 1.3 billion people, how is it actually going to get affected? So I believe that there was a fairly courageous decision that was taken to really go for a lockdown. But now if you really look at the whole issue of vulnerability, it makes sense as to why government actually made the right decision. But of course, as we really look at things, what we see is that, of course, the government has actually broken down all these locations into various sets of zones, trying to understand things. And that is what we are actually going to do for the next step. But having said that, what we are really seeing is we have done a similar kind of a thing as to what was done for the index in the US. We looked at various set of factors which matter, which was health infrastructure, underlying health issues, and population demographics. But we looked at a certain set of indicators which were far more meaningful for the Indian context, because we had to rationalize it for the Indian context. So if you really look at it, like the major risks that were identified for COVID-19 were large number of, say, elderly people who were part of the total population, a higher number of people with pre-existing chronic diseases or conditions, and poor availability of infrastructure. So if you really look at the numbers here, close to about 1% of India's population is greater than the age of 80. Close to about 10% is greater than the age of 60. It looks like a fairly normal set of numbers, but in the Indian context, it translates to close to about 140 million people who are over the age of 60. So that means there becomes a fairly huge demographic thing that we have to understand. And something very similar was in terms of understanding the healthcare infrastructure and services that actually exist. So we looked at these sets of indicators. We made a slight adjustment, so I'll not really share this more. But what we were finding was as to how various states were vulnerable here. So what we were finding is that, of course, there was different set of behavior that we were looking at. So there were the large states, and the most vulnerable were the states of Andhra, Tamil Nadu, Gujarat, and Maharashtra. Having said that, and then we said, okay, now let's try to understand it from a smaller set of states as well. Or if you really look at hill states, which are less dense, because the density levels are fairly low there. The overall density level for India is something like close to about 450 per square kilometer, but in these states it was far lower. So we looked at the hill states in a different category, and then of course the union territories, which are more governed by the center. And as we were looking at it, what we found was that of course there was this vulnerability, which was actually a sum total of all the three set of things that we were really talking about. That is health infrastructure, then of course health issues and population demographics. What we were finding was that for the health infrastructure bit, we had various set of states which were actually at a different level. So the state of, say, Gujarat or Uttar Pradesh or Bihar were very, very important for us to really look at, because suddenly when you talk about infrastructure here, the state of Uttar Pradesh has close to about 220 million people who live there in that state. And suddenly you have a health infrastructure issue. So if the whole crisis deepens in terms of large people get infected, because the most stunning number that was coming through was that if India does not go for a lockdown, assuming, then close to about 10% of the country, minimum of 10% will actually get infected. And then of course, if that is and these are the non-asymptomatic cases, and then close to about 50 million deaths could actually be seen. So this could actually end up being the worst pandemic the world has actually seen after the Spanish flu in terms of sheer numbers of deaths. In India lost close to about 20 million people during the Spanish flu. So this was something, there was a learning that was emerging from there as well. And then of course, the ranking of population demographic pillars. So what we found was that this is a reverse ranking. So like when I say Kerala is one, what we are saying is that Kerala actually has the oldest set of population. They have demographic issues here. And so we need to really look at these locations in a much serious manner. And then of course, the underlying health issues that we were really seeing. So the underlying health issues were in terms of, like, say, diabetics to whatever was being actually said for what is actually the prognosis for, say, diabetics and so on and so forth is fairly bad. So this is what we were really looking at here. But quite interestingly, India, as the diabetic capital of the world, close to about 200 million people are diabetic here in this country. So you have to be very, very careful. And that is how this index was being looked at. But we also started, we wanted to look at some numbers here. So what we found was that we wanted to look at the vulnerability scores and the cases that are actually coming as percentage of population. So what we found was that, of course, there was this thing in terms of like higher number of confirmed cases in more vulnerable states was there. So we were finding some correlation in terms of like how things were really panning out. And then, of course, if you really look at, there is also, we also looked at the vulnerability score and the cured set of people. So what we found was that greater chance of increased recovery cases in less vulnerable states. So that means that age factor has a huge bearing here. So wherever the vulnerable population was there, the demographics was not in favor, that is the place where more deaths were actually happening, or more deaths are actually happening. And we are continuing to see this trend as of today's morning data as well. And then, of course, if you really look at the death and the vulnerability, so higher possibility of death in more vulnerable states is what we are actually looking at. So having said that, if you really look at this whole thing, so what are the key findings for Indian states on the vulnerability index? Like it's the states like Puducherry, Himachal, Tamil Nadu, whatever, who are in the top 10 of both the population demographics and health issues. So that means they are in the vulnerable category, but need to define measures to protect the vulnerable population. So immediate measures will have to be taken here, and so on and so forth. So we are actually able to give some kind of policy actions here. So what we are really using this index to really get back to the government in terms of saying as to what policy actions need to be required to be done. So in the short term, what you can do is that the lockdown of the state should be eased based on their vulnerability. So wherever, and that is exactly what is actually happening right now. So what government is saying is red districts to what I call green and orange. That is what you're looking at. So, but what we are finding is that these are the vulnerable places. This is where infection rates are rising, and so on and so forth. And the medium term, the question here is that we have to look at is how states should identify and monitor the vulnerable population. So how do we actually look at identifying people and doing the testing to really see as to who's infected or whatever. So there are steps being taken here in terms of the Arogya Setu apps and so on and so forth. So that's a proximity app that they've created. And in the long term, like it's about mass testing and social distancing protocols to be adhered to, because very clearly this is one crisis which is not going away. And as we understand it, it is a crisis which is going to be there for at least a couple of years, or until the time the vaccine is not found for this. So these are a few insights that we actually got from this set of index. But the next steps is that we are actually looking at or trying to understand variance within districts. So we are really going to take it forward for the level of states. We have done it for states. We are going to take it for cities, and we will take it for districts as we are actually going along. And then, of course, we will talk about resilience at the level of districts as well, to see how the global measures and how India actually stack up. And probably there are some learnings there. So thanks a lot for the opportunity. I hope I made some sense.
I mean, of course you do, as always. Thank you very much, and a great piece of work. And I think, you know, an important reminder about, you know, India as the diabetic capital of the world, and that, you know, the risks are not, you know, the caricature. It's the world is a complex place, and that's a real threat for India from this crisis. Now, my colleague Lou Greaves has shared a link to the stuff I shared already in the chat, if you'd like to look in any detail of that. And Amit, you'll be publishing this India index fairly soon, I think. So that'll be available to people, if not straight away, but very soon you'll be releasing it.
Yes, so you will see it hitting, what do you call it, being released on Monday. So these are the preliminary things, yes. So it'll be pushed out on Monday itself.
Excellent. So you lucky people, you've had an exclusive preview of the vulnerability index for India, and before it comes out on Monday, produced by the Institute for Competitiveness India, is Amit's organisation, as you saw. Now, if you have any questions, do pop them into the chat. We have Matthew Bishop waiting to offer some thoughts and reflections. But before we go there, I want to do a couple of things. I wanted to give you a chance, if anyone's got any questions, to ask them now. But also, if I may, very unfairly pick on two of my colleagues who are on the line. Petra Krylova, who built the Resilience Index. I want to give Petra a chance to offer any thoughts about the data, if she be anything I've missed in the analysis that's worth sharing. And also our colleague Justin Edwards is here, and Justin led the team that built the US Cities Vulnerability Index. And I think, Justin, you've got some interesting perspectives on how people are starting to use this data. Because this is the point, the data is not there as an intellectual exercise or as a creative exercise, it's there to be useful. And so that's why we've built it. And I think we've seen some positive responses from people who are starting to find this useful as a way of allocating resources, identifying priorities. which I think is what data can do. So maybe first, Petra, first of all, congratulations on the work on the resilience index. Are there any other observations from the data that you would like to share with this group? And I'm unmuting you now.
Thank you very much, Michael, and thank you very much for the opportunity. You, as always, did a fantastic job presenting it. Really, we tried to anchor our analysis in the Social Progress Index because we already knew other partners, especially across Latin America, were actually using the entire Social Progress Index to assess those resilience and their best response to the current crisis. And we were thinking about how can we best offer support, and is there something more we can do with the Social Progress Index and with the data that we have globally. So we looked across the board, across all of our 12 components, looking at the relationship between infectious diseases, which we used as a loose proxy for COVID, with all the caveats that Michael has mentioned, and combining both statistical findings as well as conceptual, which was very important. That's how we derive those three components of water and sanitation, shelter, and health and wellness. There are a little more details in the paper that we produced. We also looked at some individual indicators, how, for example, access to basic essential healthcare services is related with infectious diseases, and to a very great extent, unlike quality healthcare, which was actually a little bit of a surprise to us, that that relationship was much, much looser, if any. But I think that will be my 2 cents to this group.
Great, thanks very much, Petra. And I think there's an important point you made there about how we've looked at the relationship with infectious diseases that exist and that we know about. What we don't know is, are there features about COVID-19 that are going to be different from other infectious diseases? You know, one possibility is if we see some countries that have been successful in stopping the spread of this disease, some, not all, have been countries that aren't great respecters of human rights. And are we going to find that more authoritarian countries that give less human rights are more effective in response? I'm not saying that's necessarily the case, but that's a possibility we'll have to explore. Would we find that countries that are more inclusive, more cohesive, are better at imposing and getting people to stick to social distancing measures? We don't know. There may be characteristic aspects of social progress that are important for stopping COVID-19 that are different from other infectious diseases, but we don't know about those yet. Let me just go down to Justin Edwards, who is our North America director, and built the vulnerability index. And Justin, you've been out, this data's been out for a couple of weeks. You've been talking to various cities and community governments in the US. What's been the reaction? Are people finding this useful?
Yeah, thanks, Michael. You know, just a little bit of background and also sort of the motivations in doing this. Our team in the US, in preparation for building quite a large index later this year, we're looking at all the data available to measure a broad number of cities across the US, looking at a couple that enabled us to quickly develop this for the 500 largest cities. So we were already sitting on some data assets already, and it sort of just became clear to us that, you know, if we have something right now, you know, this was our motivation to put it out and sort of test it with our partners before we actually published it. We wanted to make sure it was going to be useful and we weren't just adding right to the info stack. The way that we sort of approached this was looking at some of the CDC recommendations themselves and trying to really just do a very tight crosswalk between the risk factors, but in terms of the infrastructural sort of assets, the underlying health issues that the CDC itself, as the leading authority, had published and determined to be contributing to greater vulnerability. What we were seeing in the early days of, you know, COVID really hitting America's cities and the nation broadly was that there was just so many mixed messages out there. What's vulnerable? You know, there's some classic examples. We don't need to double back on them. You know, just in terms of the veracity of this being a pandemic or something special or something different than the flu. And we just really intended to take that CDC authoritative sort of assessment and use the statistics that were available in the most sort of, easy to understand way. We're happy to see a lot of the positive response we've gotten. We've been added to a number of aggregated data sets to help sort of address COVID impact and planning and mobilization of resources in cities and regions across the country. In particular, some of our partners, current and past, have actually really come back to us and said how much this is helping them plan. I think of a partner of mine, Con Russo, who's a former mayor's strategic advisor in the city of San Jose, California. He's now working for the San Francisco Foundation and really targeting homelessness in the Bay Area. They pivoted a lot on their grant making strategies and indicated that they were already using the data for San Francisco and other communities on the peninsula to help sort of address the grant making needs in some of those most vulnerable communities. In other places like San Mateo County, California, where we're working with the County Board of Supervisors, they're really working with us now to even localize further beyond just the few cities that are captured in this 500 cities index itself. And then elsewhere, I mean, Michael, we've been on a couple calls with folks in Florida. We've got some emerging partners in Miami-Dade County who are really, really concerned about this. I think yesterday the news just broke that Miami-Dade is only one of 2 Florida counties that will not be opening up in the state, particularly because they have some of the more vulnerable populations in dense, in a dense density perspective. And so we're continuing to see people use the data. We're continuing to see some opportunities also to go into even smaller communities and do some of this similar mapping. I think one of the greatest challenges for us really is to be able to look not just at one particular ethnicity and its kind of focused impact. Michael's slides showed the percentage of African American populations in some of these cities, but we also have a lot of other populations that are being sort of left behind or otherwise invisible in the stories. So we're going to try to do a second wave and sweep here and start to look at some other, the Latinx community, looking at some also demographic data in terms of elderly people living alone versus elderly people living in a family environment and structure, which is another opportunity to help equip, direct service organizations, charities, and governments to target some of those who are even, at the highest peaks of vulnerability right now.
Great. Thanks very much, Justin. That's great. Just want a quick question we've having from Nina Steenson, welcome Nina, nice to see you on the call, who's asking for cities to assess vulnerability, resilience, and to prioritize actions in relation to COVID-19. Would you recommend SPI as the main tool, or rather indexing specifically related to COVID-19 as your example from the US? I think we very much see these as being different parts of the jigsaw. I think the Social Progress Index, the work we've done on resilience, is telling us something about the resilience of cities, the resilience of communities, which applies to cities, to the disease. But you've also got to look at the vulnerability. And then your third point, the third issue is going to be about the effectiveness of your response, the speed at which the virus itself is spreading. So very much, I think these are 2 complementary tools. What we haven't yet done, which we'd love to do, is actually bring those 2 perspectives together on a geography. So we actually have the resilience and the vulnerability together. I think would give us a much richer picture. And we're starting to talk about expanding both of these data sets geographically. So again, ideas on where this data will be useful, who we can share it with would really be gratefully received. So it's a great question. I think very much complementary tools. And I think the more data that we can offer to people, I think the greater the usefulness it's going to be for government bodies, but also for non-profits and for businesses who are seeking to contribute. Plenty of time for more questions, but I want to give Matthew Bishop, who from the Strategic Advisor to Catalyst 2030, a member of the board of SPI, and a good friend, to offer us some thoughts and reflections on this data and generally about the response to COVID-19. Matthew, over to you.
Yes, thank you, Mike. So two very quick points. As a co-founder of SPI, who now sits on the board, our ambition when we set out to create the SPI was that we would move the debate away from GDP per capita as a measure of whether a country was doing well to a much more granular look at the kind of things people expect from a well-run society, and to be able to start comparing on all sorts of different metrics what makes one place function so much better than another place. And what we've found over the years is that moving below the national level to the kind of granularity we've just had explained to us, both with the American work and the Indian work, that's actually starting to produce richer and richer findings that are much more useful to social entrepreneurs and other practitioners working away at tackling problems on the ground. And really this work, both by Amit and by the American team, I think is the most exciting example so far of how the more granular we get, and the more we can actually start to really provide useful insights. And there will be, as Amit hinted, a lot of learning from this work about our prediction tools and how actually they play out in terms of the actual outcomes with COVID. And I would just, as a plug for the organization, SPI is very lean and, as we've seen, quite agile organization, and so relies really on partnerships with organizations like the Institute for Competitiveness in India on the ground, and people who really want to use the data. And so, this analysis could be repeated in any of the countries that we cover in the index, but would need a local partner and would need the funding to do that. But I think it would be a very good investment. So if anyone's interested in that, they should obviously reach out to Michael and the team. The second point, though, related to that is, this is only the early stage of a crisis that is going to go from being a health crisis to an economic crisis. The health crisis, has been so far most publicized in a number of developing countries, but I think developed countries, and as Amit hinted, is going to get quite big in a number of developing countries. So that has still quite a long way to play out. But then this second phase of the economic crisis is also going to be coming. And already it's very clear from the countries where there's been a big hit by COVID that inequality of access to many of the things that make for a good society, is absolutely crucial to how bad things get. And so the more unequal countries, and we've been calling out America for a long time as lagging behind where it should be on GDP per capita in terms of the SPI. Low social progress per capita relative to GDP is actually a sign of those kind of fundamental inequalities that really in this kind of crisis come home to roost. That's probably also going to be very true of the economic crisis that follows. And what I hope will come out of this, and where I hope there'll be a lot of opportunities to partner with other people and social entrepreneurs and others who are trying to build back better out of this crisis, is that the SPI, I think, really does frame very well where the priorities should be in terms of the response to these two crises, so that ultimately when we go through this horrible time and come out the other side, we are on a much better track. And ultimately it would be great to be on track for the sustainable development goals, which, as Michael and team calculated last year, we're not really, even before this crisis, we weren't on track to hit until 2073 or something. Now probably far later than that, unless there is a very serious change in strategy on the ground. So I think, just thinking longer term, how we all as a community partner together around getting onto that better track out and using this crisis as an opportunity to make the kind of systemic change that's needed. We hope that the SPI and the kind of collaborative focused comparisons of different sort of inputs into the SPI and how they work out on the ground in different localities, that kind of work will be an essential part of having a data-driven long-term response to this terrible moment that we're all going through.
Great, thank you very much, Matthew. Amit, I'd love to get your reactions to what Matthew said, but just give you a moment to think. It's one thing I want to highlight is, as Matthew says, we've used Social Progress Index as a way of projecting how we're getting on towards the SDGs. The answer we've got back so far before this crisis was that on current trends, the earliest we would hit the SDGs is 2073. The only plans I have for 2073 are to be dead, so I don't want to wait that long. So we've really got to think about how we can accelerate that progress. COVID-19 has the potential to set us back enormously, or it also has the opportunity to galvanize us to think about what needs to be done to really take these goals seriously. And I think to another point that Matthew made is this point that there's this link between social progress and economic success that's absolutely critical. Sometimes the social gets treated simply as a cost, a nice to have. What we're seeing in the COVID-19 crisis is that countries that have not laid the foundations, the social foundations in terms of equity, good health systems, will be hard to hit and will pay a higher economic cost. Social and economic value are not separate. Strong societies build strong economies that are resilient to shocks like this. And I think that's going to be a critical part of the messaging and the way the world needs to respond to this, is to understand that, and building back better with more resilient societies means more equitable societies and ones that deliver the SDGs. I've got a question from Steve Podmore. I'll come to in a moment. Thank you, Steve. But Amit, let me just give you a chance to respond to Matthew's comments.
One is, of course, like when you say 2073 as a point as to whether we will achieve the goals or not, definitively not. It is just not happening in 2073, given the conditions. But I do agree with you that, yes, this is going to be a force which could galvanize. I can actually give you some very interesting news from India. Suddenly, we are actually seeing the clearest possible weather, or clearest, absolutely low pollution in the last 30 years. So there are people who are already making a lot of noise in terms of saying, like, we should seek this kind of environment or this kind of what you call conditions to operate in. So there is going to be a push from the population in terms of moving forward to protecting the environment, for corporate to change their rules or the way they're actually playing, and so on and so forth. So there could be a whole huge shift across in the country in terms of like how they look at things and how the corporations would actually react. I think this is going to be a battle wherein it's going to be a whole huge thing of how the new wage capitalism is actually going to turn out. But when you actually say the second thing in terms of saying social progress and economic progress, I don't think we can actually look them in silos. They have to be looked at in tandem, because economic objectives and social objectives are together. And I can definitively say that in the Indian context, whatever has happened in the last 10 years, what we have seen is wherever we have seen the rise of social progress, that is when we have actually seen economic growth happen in those regions itself. So the regions or districts which have done the best on social progress have actually seen the best of growth as well in terms of opportunity and so on and so forth. So I think if somebody says that they can actually go in different tangents or whatever, it is not happening. We have to push for social progress. That has to be in our underlying conditions. Because if you have healthy people, great infrastructure, that's when things are going to happen, because the deflationary effect of these sets of things can actually be huge. And the third thing that was absolutely striking was in terms of like how this can actually pan out into an economic crisis. So I think that is where we have to be very careful in terms of like how we open up our economies. How do we really look at things? How do we make our systems resilient? This is also a very big call for countries, that you have to be ready for pandemics. It's not something that is going to happen in once in 100 years. But if it happens in once in 100 years, you cannot actually expect an absolute depression to happen. And that is what we're hinting towards or moving towards. So we need to actually build resilient systems which are going to stay, and so on and so forth, and so that you're able to manage these crises better. But having said that, economically, there are going to be challenges, but that's what we have to face, because it's always about question of life versus economics. And I think countries have had to take a choice or make a choice towards life. So thank you, Michael.
Right, thanks, Amit. I think, as you're right, it's all to play for, about what kind of, how we're going to come out of this crisis and how we're going to respond, and making the cases that you have done for that indivisibility of economic and social progress, and building back better is going to be really, really critical in the response. Steve Podmore has asked a very big question, as you've seen in the chat. I'm curious, what do you need to get SPI optimized and widely accepted, and most importantly, acted upon? Essentially more on vision and model. Steve, thank you. It's a very big question. maybe just two very short responses, since we're running short of time. I think one is critically for us, it's always about how partners like Amit and other partners who are actually on this call are the real drivers of using this tool, not my organization's social progress imperative. It's local partners who are taking this data and using it in their own context will be the drivers of this. So as Matthew said, what we're looking for is more partners who want to take up and use this data and find ways of making it useful. And that's a key thing, demonstrating this data is actually useful to help people make better decisions, whether that's in government or business or civil society. And so we've more work we need to do in making the case and growing that network of use cases and use models to help people using it. I think the second one is demonstrating why this is critical and useful, particularly for the business community. And this goes back to what we've just been saying around the relationship between economic development and social progress. If we can actually demonstrate to people that this is critical data that investors need to be taking into account, businesses need to be taking into account, that's going to be a key part of scaling this as quickly as possible. So Steve, love to talk more about that one. Anyone would love to hear thoughts on how we scale. We're always interested in forming new partnerships. Let me just open up for any final questions if anyone's got them, since we're closing. And Matthew, just any final thought from you? Matthew, are you still there? Is Mr. Bishop gone? Maybe we've lost Mr. Bishop. So we will not have a final thought from Matthew, unless he's come back. So we'll miss out on Matthew's final thought. But one thing I want to let everyone know about is that we're working now on the 2020 Social Progress Index, and we'll be revising our SDG predictions in that time. And what we're going to look at is what can we learn, what can we model based on previous economic crises, previous health crises like SARS in Asia, to try and refresh and update some of our predictions on what that trajectory towards the SDGs, to try and understand what that challenge is. Where are we seeing the problems? And I really want to emphasize that, I think what we're going to see is that the challenges aren't just going to be about health. Challenges will be around issues like human rights. There will be challenges around building more inclusive societies, but there's also opportunities. As Amit said, if we've actually seen what a less polluted world looks like, and if we can visualize that, maybe we can hope that's going to galvanize action. So we're working now on refreshing those projections to say what's the possible impact of COVID-19 on the path we're on towards the SDGs. Pretty confident it's going to be more difficult, but then also what's the opportunity to make things better and get there faster. So thank you all for joining us. As I said, drop us a line, any questions you've got. I know we threw a lot of data at you. We really appreciate you joining. All the data is either available or is going to be released on Monday, and we love feedback. We've had have to move very quickly to get these indices and new measures up. What I've learned in all my years working in social progress imperative is the more feedback we get, the better it gets. So please drop us a line, let us know what you think. We love your feedback. And thank you so much for being here with us. Cheerio.